Right now at 4:30, a cyber attack recently disrupted cancer care for several Metro Atlanta patients.
Swedish company Elektra, which has its U.S. headquarters in Dunwoody, officials there say the attack began last week. It either delayed or disrupted radiation treatments at Emory St. Joseph's Hospital. More than 40 healthcare sites across the country have similar issues.
An Emory healthcare spokesperson released this statement on the attack, saying in part, "We are sorry for any inconvenience this may have caused. Emory Healthcare takes this event seriously, and we continue to work with Elektra to provide secure, quality patient care."
Joining us now is Richard Demillo, who is the interim chair for Georgia Tech's School for Cybersecurity and Privacy. Professor, thanks very much for joining us today. From a hacker's standpoint, a hospital, a network of hospitals, why would that be a good target for them?
Well, I think Willie Sutton said he robs banks because that's where the money is, and hospitals are in that category. They deliver life-critical care, and they will spend a lot of money to avoid harming their patients. It's an easy target. It's got a motivated victim. Depends on who the attacker is, I guess. Criminals are in it for the money. State actors may be in it to sow chaos and fear. Terrorists may want to do the same thing. There may be political motivations. Really depends on who the attacker is.
Mr. Demillo, you said something that really stood out. You said easy target. Last year, the FBI's Internet Crime Complaint Center logged 791,900 complaints of suspected internet crimes. That's an increase of more than 300,000. This has prompted what we have seen, really not just here in Georgia, but across the country and internationally, a surge in cyber crimes.
Right. It's been a really interesting year because we've done so much of our professional life and social life online. So there's more activity and probably more naive users that haven't protected themselves properly. They become easy targets for criminals or whoever else wants to do them damage.
Yeah, so often we don't have any control over our information. We have to hand over certain pieces of personal information when we check ourselves into a hospital, for example, or something along those lines. But in situations where we can sort of try to protect ourselves, what are some of the ways that we can secure our personal information so it's less likely to be lost during one of these kinds of events?
Yeah, good question. So there are near-term steps that you can take. I think everyone has been told don't use 1234 as a password. It's still the easiest thing for a bad guy to try is a easily guessable password, and they have easy ways of finding out what your address is and what your birthday is and what the names of your children are. So don't use those as passwords either. You should use things called multi-factor authentication. That's the kind of authentication where you get a code back on your mobile phone in order to complete signing into a website. It's less convenient, but it's the first line of defense. You should also monitor your data. There are a lot of ways of doing that. You can sign up for services that will inform you when your data has been compromised by some third party. A little longer term, and I see this because I'm in education. Learn the skills. You need to know some basics about information technology and communications and mobile communications, and what the risks are, and that'll help you just to be a better and more informed consumer. And finally, I think public involvement in pushing for stronger privacy legislation, privacy laws, is something we can all participate in. The U.S. is one of the few Western countries, maybe the only Western country, that does not have a national privacy protection, data protection law, and it leaves a lot of us exposed.
You give us a lot of thought on this. Thanks so much, Richard Demillo, the interim chair for Georgia Tech's School for Cybersecurity. We appreciate your time this afternoon.
You're welcome.